Do you already have a strategy, a national action plan on how to respond to the pandemic, and ano yung magiging priorities mo and first steps, first actions to recover or respond to this pandemic?
Basta it will be run under the principle of we must learn how to live with COVID-19 and go back to work safely. Because this virus will stay. Science will agree with me. This will stay in 2022. Hopefully will be suppress the infection and wala nang mamatay. I hope marami ng gamot and all other things, no?
So in concrete terms, what does that mean? As what's your plan in
We
terms
have
of
to
testing, tracing, etc.?
We cannot keep on hiding. We cannot keep on locking down, flip-flopping. We cannot do that. We cannot do that. Kailangan natin harapin to, sama-sama tayo. So, that is why, when we had that in our mind, the way we're doing in Manila, you know, trying to live with COVID-19, may trabaho ang tao, makapagbukas ng negosyo, I opted to choose a vice president that can help me address the pandemic and dedicate his time, no, to help me addressing the nation's problem. And there are two things, health and jobs. I will involve an infectious doctor. I will involve a pulmonologist. I will involve those people who knows how to manage yung hospital administration. Key people, a specific career on a specific task, creating an orchestra, playing different music, instrument.
IATF pa rin? Or, kasi IATF composed of cabinet members.
It will be, basta sabi ko siya, si Doc Willie will be part of it, and I will be part of it because I offered you my time. I'll give time to that. Like literally directing and, you know, creating policy, participating, and giving goal and objective, and I always wanted results. We analyze quick. I wanted result. That's been happening in Manila. Key people, directors of hospital, MHD, health centers, doctors, then ako. Then we sit. Other agencies. Wala nang task force ganito, task force ganyan. Ang dami nagluluto, masisira yung ulam.
Yung pandemic has also exposed the dismal state of our healthcare system, di ba? Parang onti-onti bumubukas tayo, but we are basically condemning our healthcare workers to a certain fate because as long as we open up, hindi, but yun na nga yung nangyayari. Because when we open up, more cases pour in, and napaka-limited ng ating healthcare system. What do you intend to do about the healthcare system?
Very good question. When we vaccinate, okay, let me, hypothetically, this is going to happen. We vaccinate. We reinforce our facility. If Manila can build 344 COVID bed hospital in 52 days, what more we can do in 1 year, 8 months? Sana.
But how about the manpower for that? Kasi we can build, but what about the doctors? We don't have enough.
Then let me finish.
Okay.
We build it. We hired. Try to convince medical professionals. No? Samahan nyo kami. Which we did. Successfully hired doctors, not pulmonologists, but regular doctors, nurses, ample healthcare para sa COVID-filled hospital. Then you have a space.
How will you attract them?
Then we build facility on it. The basic needs of any patient na COVID patient, no? That's what we call, this is now our ample care. Proper care, when you go severe and critical, we build our own, nagdagdag kami ng mga ICU setting, ICU-like setting. We cannot build, rearrange immediately hospital because it takes time. But what matters most in a kind of setting is the equipment. So we bought tools Then we have pulmonologists there. We have infectious doctor there. So, while we're opening up, or before we open it up, kailangan mapapanatag natin yung mga doktor at nurses that there is enough facility, equipment, medicine that are available that doctors can prescribe to help a person, severe person and critical person survive. We buy this, we stock this, no? Project, create a projection. How much do we need if and if set A, set B? So, you address it, and then you talk to your medical frontlines. Tulungan nyo na ako. Buksan natin ang ekonomiya. I guarantee you, we have this, we have that, we have oxygen. I think yung mga doktor papanatag. Kaya naman hindi sila mapapanatag ngayon because they know, and I know, the real situation in a ward, in an emergency, in a parking lot,